Good morning, good afternoon, and good evening to all of you, since we have participants from all places around the world. Greetings from Costa Rica. My name is Adriana Salcedo, and I am an assistant professor at the Department of Peace and Conflict Studies at the University for Peace. Thank you very much for joining us today to discuss a tremendous relevant topic for all of us these days, the impact of COVID-19, the gender impact of COVID-19 with Dr. Uzma Rashid. But before that, please allow me to say some words regarding the University for Peace and our department. UPeace was created by the UN General Assembly Resolution 3555 in December 1980. So we are actually celebrating our 40th anniversary this year. UPeace has been training leaders in peace and peace building for more than 4 decades. It is a unique global academic institution with over 2,000 alumni hailing from more than 120 nations. Here in the Department of Peace and Conflict Studies, we host 4 master programs. We have a master program in peace education, one in media and peace, a master in international peace studies, and a master in gender and peace building. Our focus of our master's degrees share a common goal of providing a critical understanding and analysis of the root causes of conflict and violence in diverse local, communal, national, and international settings, but while also focusing on various dimensions, strategies to resolve conflict, but also transform and build a more peaceful world. Our distinguished presenter today coordinates the Gender and Peace Building program, and I would like to share with you a few words with you regarding her trajectory. So Dr. Uzma Rashid currently serves as an assistant professor in the Department of Peace and Conflict Studies at UPeace. Prior joining this institution, she worked as the chair of the Department of Sociology and associate dean for research at the School of Social Science and Humanities at the University of Management and Technology in Lahore, Pakistan. Dr. Rashid did her PhD as a Fulbright Scholar in the Interdisciplinary Language, Literacy, and Culture program at the University of Maryland in Baltimore, United States. She has extensive teaching and research experience in a variety of contexts, and her current research intersects lying in the intersections between gender, religion, race, ethnicity, class, with a particular focus on intersectionality and inclusivity in peace building efforts. So please join me in welcoming Dr. Rashid today. Thank you. I think Uzma, you are on mute. You need.
Okay, can you hear me now?
Good.
Yes, okay. Hello everyone, good to see so many people from so many different places. I can already see that you've initiated conversations in the group chat, connecting with people. So good job on that. Continue talking to each other. Just feel free to tell each other about yourselves, where you're from. I can see everyone is sharing where they're from and also maybe what you are engaged in with life right now. It could even be looking at the ceiling, I guess, no judgments. But whatever you're engaged in, maybe that would be nice to share. So should I'll start right now. I'll share the screen here. Is this visible to everyone? Yeah. Okay, so the presentation today, the discussion I wanted to have was about the gendered impact of COVID-19. That's the topical issue that we're dealing with right now, and a lot of different aspects of our lives intersect with it. There are many different ways in which we're dealing with it. And gender is something that I focus on a lot, among other things. Um, I think I know that there's a diverse range of people who've joined us today, and some of you might not have a background in gender studies or might not have delved really deep into it. So before I start talking about the gendered impact of the pandemic itself, I wanted you to sort of jog your minds a little about what you think gender means. What is gender? What do you think this term implies? And you can, because I cannot see the group chat really, I cannot look at your responses, but it will be useful for you to get going as well and to get engaged in the conversation without necessarily engaging with me. I will look at those responses later. But yeah, what do you understand gender to be? What do you think this term means? Um, Somebody's laughing. Can everyone please mute their voices as well? I do love laughter, but um, when there's a lot of people, it might get a bit much. So let me start talking about what I understand of gender and how I'm operationalizing this term for today's conversation, how I'm looking at it and how scholars have looked at it, what it means. So gender is oftentimes, seen in tandem with or used interchangeably with sex as well. So a lot of times people would say gender instead of saying using the term sex, or use the term sex instead of gender. But there are some differences. I just wanted to point some of those out first. Scientists have defined sex as biological characteristics of an organism. Sorry, I'm also sort of figuring out the dynamics of this right now. So scientists have defined sex as the biological characteristics of an organism related to one's reproductive capacities, including one's external genitalia, chromosomal makeup, hormones, reproductive organs. So mainly when we think of the term sex, what we think of is biological characteristics or biological features or nature primarily. But when we use the term gender, mostly what we're referring to is the culturally mediated expectations and roles associated with masculinity and femininity, how one should behave in relation to being a man or a woman or other genders. This is distinct from the biological understanding, but at the same time, it's important to understand that these are not binary opposites. They do influence each other. Biology is related to sociology as well. When the sex is assigned at the time of birth, the modes employed to determine whether it's a boy or a girl, they are socially determined as well. At the same time, when we look at someone and we say, this person should be behaving in a particular way, this way or that way, we are also basing that partly on our understanding or our perception of their biological characteristics. So sometimes we would say, for example, girls are not good at sports, or girls should not be engaging in this particular sport because they're weak and they should not be, that's their biology. They're not built for it. So biology and sociology or our cultural and social understandings of how one should behave or what our expectations are, they go in tandem with each other. And there aren't a lot of sharp distinctions. There are blurred boundaries as well. A lot of times, even when we're saying, this is nature and this is biologically determined, even there are blurred boundaries. When we talk about intersex people, for example, that's a case to look at and to understand that it's not always clear cut when we're looking at biological distinctions. A lot of times the terms sex and gender are also interchangeably used. So that is fine. But when I am considering the use of the term gender, I am using it to mean culturally expected or culturally mediated expectations and roles. What does gender and sexual diversity entail? Normally when we talk about gender and sexual diversity, we're not just talking about men and women, we're talking about a broad range of a broad variation in identities, expressions, and behaviors and feelings of attraction we see in human sexual orientation and gender identity. In particular, there has to be a focus though on individuals and communities that are marginalized based on their gender and sexual identity, because we know that even within these large groups of men and women, you can see different sexualities, different gender identities in there. People identify differently and people express themselves differently. So we have to consider those differences, and we have to consider the marginalizations that come from those differences. And we have moved from gender binary to gender non-binary conversations as well. We don't necessarily just always talk about men and women. We do consider the LGBTQI plus community as well. But I have to point out that most of the data that we have, or most of the research that is being done, uses gender binary language, still uses gender binary language, and still talks in terms of men and women. Men experience these, experiences, and women have these inequalities, etc. And one of the reasons is that in a lot of contexts, we don't even have data available to make claims about the LGBTQI plus community. In a lot of social contexts, it's taboo to even consider these categories as valid categories. They're not even considered valid enough, so when they're not considered, when they're not part of the legal system, when they're actively criminalized actually in many legal systems of the world, it's not possible to collect data about those. And when we don't have data, it's hard to have conversations about gender non-binary individuals. But I will focus at some point in my conversation, my presentation, on gender non-binary individuals and the LGBTQI community as well. But if you see a lot of discussion about men and women, part of that is because the discourse, the international discourse, and a lot of research functions with these binaries. And it is also important to understand how these large groups of people experience inequalities or deal with gender relations, because they are present around us. So why is gender important in our lives? How does gender shape our lives? First of all, like I mentioned, sex is assigned right at birth, at the time of birth. So it's just that important. It just starts from the very time, the very moment we come into this world. It's imposed on us. Different attitudes and behaviors at the same time are prescribed based on perceptions of how one should live in line with their sexual and gender identification. Some behaviors are considered masculine, some are considered feminine. And some of those gendered attitudes are valued, others are denigrated to lower positions. So all our lives, we are told, if you behave in this way, if I, as a girl, speak, as a woman, speak loudly, that is not a desired behavior in many social contexts. If I engage in, being assertive in my professional life, I would be replicating what's considered male behavior, and that would be prized. So a lot of these dynamics exist all around us from the very beginning of our lives. And then there are differences and inequalities in access to opportunities and resources. It's not just, differences in behaviors that are equal to each other or considered the same or valued the same way. Some are valued lower than others, and there are differences and inequalities in access to opportunities that a lot of times are gendered, and we'll talk about those as well. But it's important that I mention, I don't consider, and gender studies scholars try not to consider gender as synonymous with women. We're not just saying that if we are studying gender, we are only studying women, we are studying gender relations. So the relations of different people associating with different gender identities is what we're looking at, and the consequences of those gender identities on the inequalities that exist. That is what we're interested in. Like I mentioned, when we talk about gender not being synonymous with women, part of that is that men are also affected by patriarchy. So expectations of masculine behavior work to the detriment of men. Especially men who do not live in line with expected gender behaviors are harmed. So gay men, trans men, they are harmed by their behavior because it's not endorsed by society or valued by society. And men are expected to not show and share their emotions, to behave in violent ways. Apart from valuing aggression in men, this also leads to the silencing of men and boys who experience sexual violence. So a lot of times, when people talk about why aren't you as a feminist talking about men's rights? There are a lot of people who are talking about male gender and sexual and gender-based violence, but it's not considered gender-based generally a lot of times by people who are not part of this discourse, part of the gender studies, discourse in general. But it is, there's a lot of conversations happening around that right now. Um, but because it's taboo, because these behaviors are prescribed, because this behavior of aggression is prescribed and men are not expected to show any emotions and not show any weakness, they end up not reporting sexual violence that they experience as well. Men are raised to be breadwinners by limiting their academic and professional choices. So that's another thing that limits their, even though they are benefiting from the system of male domination that is patriarchy, they also suffer the consequences that come with that kind of domination, because power and such violent use of power cannot leave your own community unharmed, right? So we do see the violent repercussions of this power and domination amongst men as well. Gender inequalities are real. How are they real? Because a lot of times when we talk about gender inequalities, people think it's all in our heads and we just, talking about superficial things which don't really translate into any meaningful differences. And, that there are other factors which influence inequalities more than gender. But there are ways of measuring gender inequalities. There are ways of figuring out how patriarchal oppression works in gendered ways, works to the detriment of women. So for example, this gender inequality index measures gender inequalities in three important aspects of human development, including reproductive health, which is measured by maternal mortality ratio and adolescent birth rates. There's also empowerment, which is measured by proportion of parliamentary seats occupied by women and proportion of adult women and men aged 25 years and older with at least secondary education. And then there's economic status as well, which is measured by labor market participation, and how many women or men are participating. So considering these different dynamics or these different categories, reproductive health, empowerment, economic status, and there are other measures as well. There are other ways of measuring inequalities too that different organizations have taken up that you can look at, which see how these different indicators are different for men and women, how this data is sex disaggregated. And they all indicate that women are predominantly bearing the brunt of these inequalities. There are differential ways in which women and men experience reproductive, women experience reproductive health issues, including maternal mortality ratio, which is high because of various factors related to healthcare, and so on. So these inequalities, just to reiterate, are real and are measured by actual indicators. Different states, different governments provide this data, which is brought together to figure out what the level of inequalities are in different countries. And you can see whichever country you belong to, you can look for the gender inequality index or the gender gap index to see what position your country falls at. And one thing to keep in mind is, even if your country is doing really well, one of my students, some of my students are from, Iceland or other places which are doing really well on these lists. But it's important to keep in mind that even in those places, there are gender inequalities that exist. No place is still perfect to the extent that it would accord equal status or equitable opportunities to both men and women in all areas, including, removing experiences of harassment from their lives, among other things. So gendered attitudes towards COVID-19. Let's see how these gendered inequalities are influencing gendered inequalities, especially considering this pandemic. One of the things that we keep hearing is, in relation to the pandemic, is that it does not discriminate. It affects everyone equally. But we know that that's not true. gendered attitudes, gendered inequalities, class-based inequalities, racial inequalities, ethnic inequalities. All of those work towards ensuring that the pandemic is also affecting people in different ways, because we exist in systems that are based on oppression in different forms. We are based in systems that are discriminatory. We experience natural disasters or crisis differently too. So this pandemic, COVID-19, is no different. We can see from the data that different communities are experiencing it in really different ways. So one of the seemingly superficial ways in which we can see, and I want to start off with this, it's something light, to share about how COVID-19 is gendered, is how the language used surrounding the pandemic itself is gendered as well. Now, scientists still don't know a lot about the pandemic, about the virus. They're still figuring things out. But what we do know, in the French language at least, and some of you might be French language speakers, so you'll be able to relate to this better, is that the French language guardians have now declared that it's a feminine virus, in the sense that the feminine article will be used to refer to COVID-19. And this has been a big debate, because they've actually urged people to not use the faulty article, even though the core work or the umbrella term for the virus is masculine in French. Even then, the feminine article of la is supposed to be, is expected to be used. And this does seem superficial, but at the same time, it has, language use has consequences for how people view and respond to different ideas, right? So even when we look at other natural disasters too, I did a very small scale research study once about Hurricane Katrina, which was a hurricane in the US. It was like 10 years or so ago, I think. And I was trying to analyze the language used around Hurricane Katrina because it was gendered. It was a woman's name that was used. And I know that men's names are also used for some natural disasters, but a lot of times the pattern is that the more severe the disaster, the more feminized it becomes, and the more violent the language used around it. So one of the papers that I found actually on Hurricane Katrina was Katrina You Bitch, Hegemonic Representations of Women's Sexuality on Hurricane Katrina t-shirts. So we are still in the process of seeing data which tells us how COVID-19 has been feminized, or how language around COVID-19 has been feminized, and whether it's violent or not, how people are talking about it is too soon to say. But just to give you an idea of the patterns that you can start recognizing in relation to the crisis. And this is one of the easier, lighter, seemingly lighter ones. I think it's very important to consider how our attitudes are reflected in gender, in our discourse. Another thing that you will notice when you look at different gendered attitudes towards the pandemic is the very responses towards the pandemic that are different from men and women. How men are responding to the virus is different from how women are responding. So quite a few studies have now shown a connection between masculinity and the wearing of the masks. So wearing of the mask is seen as shameful by men a lot of times. There are different surveys that have come out. And of course, we need more information, more data, but some of these surveys have shown that men refuse to wear masks. And this headline is Masks, Men, and the Exhausting Pursuit of Desperate Masculinity. How in many social contexts is seen as a sign of weakness. So toxic masculinity is going to get us all killed. That's one of the things that scholars are talking about. And when I mentioned, how masculinity, or notions of masculinity, and how men should behave, they should be aggressive, they should seem powerful, they should seem like they don't have a weakness, how they harm them. This is one of the things that harms men as well. But at the same time, this is something that harms women and other people around them too. But this is a gendered pattern that has been visible in relation to how people are responding to the virus, and it's a gendered pattern. So this mask becomes a sign of weakness, really because of its gendered connotation. So what are the gendered impacts of the outbreak? One thing that I want to point out before going into more detail is that we need to understand the gendered impact of COVID-19 in its intersections of the interlocking systems of oppression. So it's not just this one category that's operating on its own in isolation. There are multiple other categories that it works with as well. So one of the terms that I just remembered while writing this up was Bell Hook's imperialist, white supremacist, capitalist patriarchy. How patriarchy does not function on its own, in isolation. It's working alongside the capitalist system of oppression, the wealth inequalities, the white supremacist, the global white supremacist system, the imperialist exploitation, and all of those are working together and exacerbating or increasing the inequalities. So when I will be talking about gendered impacts, I'll be talking about those impacts in relation to these other forms of oppression too. But it's also important to keep in mind that in a lot of these categories, people try to undermine the role that gender plays in perpetuating inequalities by saying that it's probably class, it's more class based, it's more because of wealth based inequalities. But at the same time, when we look at these categories in isolation, when we look at the poor, we look at the category of poverty, we will see that within those categories too, gender exacerbates inequalities. You will see who is at the bottom of the hierarchies within those different groups as well. So moving on, one of the main things that people are talking about in COVID is that it's not even hitting women as hard in terms of the mortality rates as it's hitting men. So this is a Time magazine headline: why is COVID-19 striking men harder than women? So even though we don't have a lot of sex disaggregated data, which means data breakdown, which shows us how this virus is affecting men and women differently in different parts of the world, we only have it in so many. Although sex disaggregated data for COVID-19 show equal numbers of cases between men and women so far in different contexts, there seem to be sex differences in mortality and vulnerability to the disease. So emerging evidence suggests that more men than women are dying, potentially due to sex-based immunological or gender differences, such as patterns and prevalence of smoking. There were some articles that came out about smoking in particular and how that could be making people vulnerable. But again, we don't have final conclusions about it. But current sex disaggregated data are incomplete, cautioning against early assumptions. So we simply don't know it for sure at this point. Vulnerabilities could be increased even because of masculine behavior, like I just shared about not wearing of masks, or it could be because of access to healthcare for women as well. Are women even able to go in different parts of the world to get tested and to know for sure that they have the virus? And so are their deaths being counted as COVID related or not? So there are many factors at play, and it could be any of them, but this is one pattern or one element that we can be mindful of when we are looking at gendered patterns. So another thing that is important to look at that's influencing people is the gendered impact of the economic downturn. We know that right now we are in an economic regression, and of course it has an impact on who is more exposed to the virus itself, but also who is more vulnerable in the face of the changing labor force dynamics. So in the economic downturns preceding this current crisis, the ones that we experienced before, including the large recession of 2008, 2009, the employment of male workers was usually affected more strongly than the employment of female workers, because they were, in different professions such as manufacturing, etc., which got affected more by the economic downturn. But right now, what we're seeing is it's hitting most economies as hard as the deepest recessions. But given the exceptional nature of this crisis, given how this crisis operates and is functioning around us, the distribution of jobs and workers affected is potentially different from previous recessions. The gendered patterns are potentially in this virus, in this pandemic, potentially different from the previous recessions that we have experienced. How is it different? Part of that is that's the social distancing and lockdown that we are supposed to comply with, right? So depending on whether you are in a particular field where you have stay-at-home orders, for example, there has been no impact on sectors that are considered critical sectors, right? So are you more a part of those sectors, or are you in sectors that are considered non-critical? What are your chances of losing a job? Some of the numbers we have from research currently suggest that in terms of their occupation, more men than women will easily adapt to the changed work environment during the crisis. Because, for example, in the US, where 50% of the workers are employed in professions where they can telecommute, 28% of male workers are there, and 22% are female. So more women will potentially face loss of employment, which is the opposite of the pattern in normal or in the previous economic downturns. But this will also vary from context to context. So even on this, we don't have conclusive data about how the gender dynamics are playing out. We don't have sex disaggregated data about how many people have lost their jobs, how many of them were men, how many were women, and how is it affecting men and women differently in different sectors. So one thing that is important that I wanted to mention was gender division of labor, that is care work in particular, which affects women and men differently. So we know that frontline health professionals and workers most exposed to the disease are likely to be women. Nurses, nurse aides, teachers, child care workers, aged care workers, and cleaners are mostly women. And globally, women make up around 70% of the health workforce. And in some places, it's actually even 90%. So depending on the context, health professionals are most likely to be women on the front line of the pandemic. At the same time, parental childcare roles are also likely to be reversed. In general, we see in many contexts, women are the ones who are taking care of children in the household. But we will see in this pandemic that sometimes, or in some contexts at least, parental childcare roles are likely to be reversed as well. In cases especially where the mother works in a critical sector and the father is forced to stay at home due to social distancing measures. And this may accelerate the evolution of gender norms towards more equitable roles. But again, we don't know that for sure. Then there's also an important thing that we need to discuss when it comes to the pandemic is sexual and gender-based violence. Now, it's not just this crisis, but even outside of the crisis, women face the greatest danger from people they know. Globally, 64% of women who are killed die at the hands of an intimate partner or a family member. So 243 million women and girls aged 15 to 49 have been subjected to sexual or physical violence perpetrated by an intimate partner in the previous 12 months. And this number is likely to increase as health, security, money-wise heightened tensions and strains and are accentuated by cramped and confined living conditions. We also keep hearing that domestic violence is a pandemic within a pandemic. And that is also true because campaigners expect domestic violence rates to rise during lockdown periods because stress, alcohol consumption, and financial difficulties are all triggers for violence in home. And the quarantine measures being imposed around the world will increase all these. The British charity Women's Aid, for example, said in a statement that it was concerned that social distancing and self-isolation will be used as a tool of coercive and controlling behavior by perpetrators and will shut down routes to safety and support. In a lot of places, we know that women are unable to report instances of sexual violence or domestic violence and their intimate partner violence in their house right now. and partly that is because their movement is limited, there are restrictions on movement, and partly because systems have shut down. Systems of support that existed previously have shut down. France, for example, saw a 32% jump in domestic violence reports in just over a week. Lithuania observed 20% more domestic violence reports over a 3-week lockdown period than over the same period in 2019. So there's been a sharp rise in reporting of domestic violence. And this does not even begin to, I think, encapsulate the emotional and psychological trauma that a lot of women are going through in particular, because they're subjected to violence at home, and they have to deal with that along with other problems. And then gender is also, it intersects also with racial inequalities. So research conducted over the last decade shows how structural racism, which drives the social marginalization of racial and ethnic minorities and other vulnerable populations, leads to inequities in morbidity or and mortality. The virus encounters deeply racist structures and institutions already in place against the backdrop of wealth inequality, a militarized state, and a commodified culture in which everybody and everything is for sale. One tweet that somebody shared with me was, it said, "Are we under disease curfew or are we under racism curfew?" Because if you're familiar with what's happening in the US right now, it's racial inequalities along with the pandemic that's there together. And it's not clear how the pandemic will be taken care of in this situation, but at the same time, how are these racial minorities or racially marginalized dealing with the pandemic? We do know that the pandemic is disproportionately affecting the African American population in the US, for example. We do have data for it. We know that African Americans overall in the US, I think they're 3 times more likely to die of the virus. In some states, it's even to the extent of they're 7 times more likely or 6 times more likely to die than white people or other races. In the UK as well, I think there's a report which talks about how immigrant communities, Bangladeshis, Pakistanis, the Caribbean immigrants, they are more likely to be diagnosed with it, and also to suffer, to die from the virus. So there are differences in how these racial communities are experiencing the inequality and the pandemic. And there are differences within these racial communities as well, in terms of how much access women have to healthcare systems, and to what extent they can be diagnosed, or they can go for testing, what their mobility is like. We don't know those dynamics for sure, but we do know that these communities are more exposed, their vulnerabilities are increased in times of pandemic. How does religion play a part? Religious beliefs or in practices also influence the differential vulnerabilities of different genders. Many religious scholars hold significant power and trust, and they can play a part in asking people to not go to churches, mosques, monasteries, etc. But we did see, at least in the beginning of the virus and even till now in some social contexts, that people refused to stay at home, and they still kept going to their worship places, and that exacerbated the situation of the pandemic. And in Pakistan, for example, the mosques were still open and people were still going for prayers, and by people I mean men were going for worship to the mosques, and the consequences of that worshipping was not limited to men alone. We know that when they come back, they would affect the whole community. Sorry. Another area that is important to look at, when we're talking about gendered inequalities and this pandemic, is migration, and how migrant workers, refugees, asylum seekers, irregular migrants, etc., how they're experiencing gendered inequalities or gender dynamics in particular during this pandemic. Because we do know that women experience vulnerabilities differently in refugee camps or as migrants. So, for example, do they have access to contraceptives? Do they have mobility enough to go get themselves tested? Do they have availability of abortion facilities, or availability of contraceptives, or sanitary facilities available. A lot of times we see that they're more vulnerable because they're more confined in camps which are already very crowded. So that is something to look at. The LGBTQI plus community is also extremely vulnerable in this pandemic. Lesbian, gay, bisexual, trans, and intersex people may be particularly vulnerable during this time. We know that there's this instance that sparked this conversation in Seoul, Korea, about when in a gay bar, this transmission was done. More than 100 people were diagnosed with, were confirmed cases of coronavirus from that gay bar, and it sparked this homophobic attitude towards people after that, towards the LGBTQI community after that. We know that the access to health services is bleak when it comes to the LGBTQI community. A lot of times, because they're criminalized in different contexts, they cannot even go to hospitals and seek medical health care. Deprioritization of required health services happens, if they are getting some treatment, it may be interrupted or deprioritized, including HIV treatment, hormonal treatment, and gender affirming treatments for trans people. There's also stigmatization, discrimination, hate speech, attacks on the LGBTQI community. We know that a lot of times this community is blamed for natural disasters and climate and crisis as well. Plus access to work and livelihood. They are the most vulnerable population when it comes to job losses, or even, because they're more part of informal economies where there isn't a lot of formal contract or protection from job loss or employment problems. They face those vulnerabilities more. There are other issues as well that you can always just look at, because they're all exacerbating or all posing the pandemic to other issues like the hurricane, earthquake, eruption of a volcano, a plane crash, cyclone Amphan. There's a movement against systemic racism that I just mentioned in the US against police brutality. All of these are interacting with the virus right now. And even though we thought the pandemic would be the biggest headline of 2020, it's really not. There's so many other things happening that it's intersecting with. So how is it intersecting, and how are these exacerbating the current inequalities? For those of you who might be interested in incorporating a gendered lens or gender consciousness in COVID analysis, there are many such rubrics available that would help you apply a gendered lens in different situations. So you can see the different vulnerabilities, to the left, and the different ways in which individuals experience those vulnerabilities, including access, policies, institutions, labor, positions, decision-making power, etc., and how these systems affect them. So what are the positions that different people occupy based on their genders in this matrix? And it's an intersectional and dynamic matrix, which I'll make this available as well later. But you can check for such matrices and apply a gendered understanding or gender sensitive lens to understand how a regular situation, how the healthcare system, so access to healthcare, what is it like for women, men, and other genders? What is the impact on informal care economy, informal care in the family, for example? So different things are a part of this, which you can use to understand gender in this pandemic more. A final question that I wanted to ask before I wrap this up is, what does the world look like in a post-COVID world? What do gender relations look like in a post-COVID world? I think that's a very positive sort of question to ask as well, because we don't even know when this post-COVID world would arrive, whether we will see that or not. But being positive, we can see the gender roles did change after World War II as well, and maybe they could change post COVID-19, because the crisis does present an opportunity to restructure societies in more egalitarian ways, in ways that the gender relations are restructured, the roles and responsibilities are changed because of how they're changing right now. But it's not an automatic, that they will change. It's not a given. We will have to see how we are dealing with this pandemic to know more later. And I'll just wrap this up. I'll finish this now, and I'm open to questions.
Thank you very much, Uzma. That was a very comprehensive and interesting presentation. We have received some questions in our chat, so let me read some of them for you, okay? So Sierra is asking, does feminism work to eliminate these gender expectations for men as well, or that would be considered something else? That was at the beginning of your presentation when you were talking about gender expectations. The second question.
Can I answer one question?
Sure, please go ahead.
So feminism is a movement seeking gender equality, right? It's not a man-hating movement, as is sometimes it's construed to be. It is asking for equality, which does mean that the power relations have to shift, right? Have to change, because we do know that one gender is more dominant in these relations. One or more genders are exploited based on their gender identity. So we do know that restructuring of these systems need to take place, and maybe that would involve giving up on some power, right? So but it's a lot of negotiation and renegotiation. It's not, that one group of people will be at a disadvantage. I think there's a lot of disadvantage in hoarding power. We have to recognize that it's not a simple, we are in positions of power and that's, it's great. It's also problematic. We have to see it. We have to think of a more egalitarian system, or a more egalitarian world in which we exist, a more equitable distribution of not just gender relations, but economic relations as well, racial relations as well, and all these systems being more egalitarian.
Thank you, Uzma. I think we have a little bit of time for one more question. So there's another question in the chat from Jelly Steven. What countries have shown the conflation of mask and masculinity? If you have any reference or any idea.
Can you say that again, please?
So what countries have shown the conflation of masks and masculinity?
Oh, like I mentioned before, a lot of this data is coming from places that already do work on sex disaggregated data, and there's a lot of research happening in those contexts. So some of what I shared is from surveys in the US and somewhere in Europe as well. I can share more links later if you want, but they're easily available. And I hope we can get more research from a lot of different contexts too. I would suspect that in more conservative societies where these gender dynamics are more traditional, and the idea of machismo or manliness and exhibiting that kind of behavior is more common, it will be more likely that you witness this kind of behavior of shunning masks as a sign of weakness.
Mm-hmm. Thank you, Uzma. I think we're drawing towards a close now. And
do we have like 7-8 minutes or no?
Yeah, a little bit. Is there anybody who would like to post another question in the chat room, please?
I'm looking forward to reading this chat later, by the way. It seems really rich. I hope there weren't no fires started there.
No. Very, very lovely chat.
But it's interesting also to see how there are different experiences from different people who are sharing, events in their everyday life where gender is reflected, like people not wearing masks in public transportation, or when somebody goes to the dentist, the dentist is not wearing a mask, or so these are things that we are facing right now.
Mm-hmm.
Julie has just shared about the evidence coming out of the Philippines of increased incestuous sexual abuse. And I just wanted to add that that's not just unique to the Philippines, that's been happening internationally. Unfortunately, it's one of the topics that's the most difficult to investigate because it is, such a secret and so taboo. But unfortunately, I do think that in 10 years, we will have significant evidence of that happening during this time.
Mm-hmm. Yeah, I mean, we're in the middle of the pandemic right now. So a lot of what I'm saying is also based on the patterns that we've witnessed before and we've seen in other crises, and how these gender relations are, the inequities are exacerbated in those times, and just some of the conjectural data or some data in some context that's pointing us to certain directions. But of course, like in 5 or 10 years, if we're still around, we'll see. Sorry for being so negative. Like, hopefully we'll be around. Positive vibes, rainbow. Oh, happy Pride, by the way. I forgot to say that. Happy Pride Month. Hopefully in 5 to 10 years, we'll see more data and more conclusive research about what happened. And one of the questions I see here is, how do I see gender relations in the post-COVID world? I mentioned some of it, but if we start working on gendered, redistribution of roles and responsibilities, which we have as gendered, we will see a drastic shift in how those are redistributed. We could see men taking more responsibilities at home, and women more involved in employment opportunities and engaging with those more. But that's also still conjectural. I think the pessimist in me, or I guess the realist in me, would say that those might largely remain the same unless we are doing something drastic during this pandemic to restructure societies.
Maybe a final question. Marie is asking you, do you think we will witness substantial shifts in gender roles after COVID-19, particularly in areas of labor and employment?
We will have to wait to see how, since I mentioned that 70% or even 90% women are employed in the healthcare sector, which is so badly being impacted by the current crisis, right? So how do we anticipate whether there'll be, what kind of a shift there'll be in those sectors of employment, which are right now predominantly occupied by women, but what do we know if most of those women are impacted severely by this crisis? How can we tell how this would change? But we do know that even modes of work have changed, right? We are telecommuting, we are working from home more and more, although even that is a matter of privilege and access. But that might also change how gender roles change at home, and in life in general, not just gender roles, but just workplace dynamics, right? If we had to meet for a meeting, maybe it's okay to just be on Zoom now.
Thank you, Uzma. I think we're heading now finally to a close. I would like to again thank each one of you for participating in the webinar today. Hopefully you got a good flavor of the type of issues and conversations we engage with at UPs. And I would like to, give a special thank and appreciation to Uzma for sharing her insights with us today. Some of the participants would like to have your presentation, and if that's okay with you, I will share with them or a recording, the link to the recording of this session. Finally, we look forward to welcoming you again. The Department of Peace and Conflict Studies have prepared 3 webinars, in this month. And the next is going to be held on June 16 at same time, 1 p.m. Costa Rican time. It's going to be with Dr. Heather Kersticia, head of our department. And the topic of that webinar is going to be education and justice in times of pandemic. So we do look forward to seeing all of you on the 16th. Have a good day, good evening, or good night, wherever you are. Thank you.
Thank you for joining, everyone.
Thank you so much. Thank you. Thank you. Thank you. Welcome to Tanzania.
Yay! Yes, let this pandemic end and we're there.
It is over. It is over now. You're welcome.
Thank you. Bye-bye.
Thank you, Adriana. Thank you. Bye-bye. Okay. Hey, the kid teaser. Thank you.
Thank you, Adriana.
Thank
You're
you.
welcome. Thank you.
Thank you very much.